Hi, thanks for joining us. I'm Annie Sleece, and I'm on the staff at NAMI Delaware. We are lucky to have representatives from the Behavioral Health Unit of the Newcastle County Police Department with us today. Before we invite our guests to join us, I'd like to tell you a little bit about NAMI Delaware and the work that we do. First of all, NAMI stands for National Alliance on Mental Illness. And NAMI, as a national organization, is the largest grassroots mental health organization in the country. NAMI Delaware is the state agency affiliated with that national organization. There is a NAMI in every state, so if you're tuned in from a state other than Delaware, you can find out about your local NAMI by visiting the national webpage, nami.org. NAMI Delaware, our mission is to support, educate, and advocate until there is a cure for serious and persistent mental illness. We offer education programs, support groups, awareness events, trainings, and presentations, as well as housing in Delaware. Since the pandemic began, we moved our programs and our groups to virtual platforms just like this. We offer meetings and program events on Zoom, and we have conversations on Facebook Live. If you'd like to learn more about what NAMI Delaware is doing now and has planned for the future, please visit our website, namidelaware.org. And also, please make plans to visit and join us during our virtual walk, May 30th. That's this Saturday. You can learn more at our website. Now, before we dive into our conversation today, I do want to remind everyone watching that you're not alone. This is a difficult time, but you are not doing this by yourself. We may discuss some topics today that generate strong feelings, so we want to make sure you know how to access immediate crisis support should you need it. There is a crisis text line that you can access 24 hours a day, 7 days a week by texting 741-741. Or you could access Delaware's new Delaware Hope Line. That number is 1-833-9-HOPE-DE. And it is just another way to access Delaware services, including the crisis services available in our state. Basically, we want to make sure that as we have this conversation today, you know how to reach out to someone, how to get some immediate support should you need it. And also, please visit our website for additional resources. We have a variety of different ones, and we also offer a helpline that you can call and connect to more resources. So let me now introduce our guests. Thank you for joining us from the Behavioral Health Unit. And I think here they are from Newcastle County Police Department. Hi.
Hello.
So we have with us today Officer Colleen Kearns and Alex Schofield from the Newcastle County Police Department. How are you all doing today?
Good. How are you? Doing well. Thanks for having us.
Great. Absolutely. Well, thank you for being with us. So it's really great to have this conversation and to share the work that you're doing, because I have a feeling a lot of people don't know what it is that you're doing and what Behavioral Health Unit is. So let's start with just the basics. Can you tell us how long the Behavioral Health Unit has been in operation and maybe how it came about?
Sure. In 2017, we received the implementation and planning grant from the BGA, which partnered us with a mental health provider. And at that time, it was Connections. So Newcastle County Police partnered with a mental health professional from Connections to develop this unit. So the first year was a lot of research on what's that really going to look like. We're going to put a mental health professional in the police car, and how are we going to address the mental health costs. So it was a lot of meeting with providers and stakeholders and see how we as an agency can help address the need for mental health costs. Because prior, we would show up at a mental health call mobile crisis, or leave a resource card and put it on the person to connect themselves to care. So a lot of people would fall through the cracks. Having the mental health person there with us kind of changed the connection, kind of changed how we as an agency looked at the mental health crisis calls, because we had a partner that could help us help the people that are calling the police problem. So the the year was challenging on how do we work with the ACT teams out there? How do we work with mobile crisis? How do we work with all the providers and the police department play well together? So it took meetings and talking, because a lot of times we were saying the same things, but we were saying them in police words, and they were saying them in mental health words, and we were missing that we both had the same goals. So we had that partner with connections and weekly meetings, trainings down in DC to see how other co-responder models were out there from like Seattle, Washington. They're up and running. So we went out and studied what they did and took a lot of advice from some of the things that they learned on how to police partner with private agencies and state agencies to help address mental health calls. Then we had a year gap where we didn't have any grant or support. So that was challenging. So we hit the road running, had the support, made a lot of connections, and then also the funding dropped. We were lucky to have Alex jump on as an intern. So she spent about
6 months. Yeah, about 6 months.
6 months interning with us. So she was in the car with me, and we were going out to handle the mental health calls and the follow-up. So if we're not available, other patrol units will send us emails and request that a mental health evaluation or connection care could be used. After she was done her 6 months, we were kind of like, what do we do now? We were lucky, Senator Longhurst provided us with a grant to keep one mental health person on. And then we actually was awarded the expansion grant, which we're working on now. So that will put 2 teams out there. So it'll be myself and Alex, and then Officer Omari George and the next partner that we bring in. So we'll have 2 teams out there. We'll work opposite each other, so we'll cover much of the day. And our goal is to make sure that we're not losing those people through the cracks, that they're not on their own connecting themselves to care. We have someone, police officer, that can answer the police questions. Can we divert them from arrest? And then Alex and the other social worker can do more of the connection to care.
Great. So it makes a lot of sense that up until your team took over, there were people falling through the cracks, because it's really hard to expect anybody to turn and take care of their own needs and their own issues if they are so very critical, and you're handing them a card and saying, here, go do this. That's just so it seems a little silly that was ever expected. So we're so glad that you all are doing this work now and helping to make those connections. So Alex, you're the social worker, right? In this team. So, and you were an intern first, and you got to stay on. And I think that's when I met you, wasn't it? Right as you were becoming. Yes. That's great. So in the role that you play, it's not just being in the car, right? So it's like before, after, like follow-ups. Can you tell us a little bit about that role that you're playing?
Sure. I am partnered up with an officer. We respond out to a variety of calls, obviously, crisis based. We'll go out and respond. They first and foremost assess for safety, and then I come in and do an assessment and sit down and talk to that person and really try to get to know them and figure out, what's going on, and keeping in mind that we're seeing them at the worst time of their life. Like, we're seeing them on the worst day of their life. If their family members are there, it's probably also one of their worst days. We're trying to figure out what went wrong that day, trying to kind of like almost putting the puzzle together. What's missing? What went missing? What's missing from this picture? If they don't have services in place, what do we need to do? Is this an emergency kind of thing where we need to hook them up, or if we need to refer them to services immediately? Or is this the kind of situation where we can keep them within the community and give them the support that way? So it's all about figuring out if it's the emergency referral that they need, and then we can also help them with community referrals when they are more stabilized, or if it's putting community referrals in place, because we do want people to stay in the community who have mental health problems. It's certainly not a reason for people to have to leave the community. Having mental health problems is a very, it happens. It's 1 in 5 people. So,
sure.
So that's kind of my role, and I follow up and just try to make sure that people are connected to the services and try to establish support networks for them and their families as well, to try to keep them as healthy as possible within the community.
What is nice having the social worker there right away is scene state, and there's no crime, but they need help, and there's officers standing in your living room. So their past experience probably is that they were committed or taken out against their will, and then we could be there with them during that crisis and say, hey, I know you might not want to talk to me, but will you talk to the social worker? We can step back a little bit. We still make sure the social workers that are out there with us are safe, but they can have a different conversation than that they would have with 1 or 2 police officers standing there. So
right. That's what I was going to ask you. It's changed your role too, right? In a way, because it's kind of alleviated that kind of weird space that perhaps you were in before, where you were trying to maybe negotiate a conversation that someone was unwilling to have because of who you are. Is that a fair?
Absolutely.
Yeah.
That's completely right. There's been a couple of times when a person needed crisis mental health and we were going to have to go hands-on. And I just simply said, we have a social worker in my car. If you walk out to the car during transport, you can talk to the social worker while we go to the hospital. Will you do that? And they were like, yes, I will.
Oh,
so awesome. The officers are safe because we're not going hands-on. The person's safe. The family is not traumatized as much from the event. Just having another resource out in the community that's there when it's actually going on has been a huge help.
That's great. That's great. So right now, obviously we're in a pandemic, so I'm sure it is not a typical day now these days, but can you give us a picture of maybe pre-pandemic, what a typical day looked like with the 2 of you out in your car, and then maybe now what's going on, what it looks like now?
Sure. So when we show up, we 10/8, so that's when we go and hit the streets, that we would check our email to look for any referrals that happened from last shift to this shift. Read through them, see who needs immediate care. Sometimes it's like they are already connected to care and their care provider doesn't know that something happened. So that's where Alex would come in.
Right. So when that happens, I'm on the phone contacting that person, letting them know what's transpired, notating, what that person's triggers may be, what works well with them in the event that this could happen again, and say the police come out in the middle of the night for a similar call and they can't get a hold of the provider. Well, we know this about this person. This works well. Talk about this. Talk about the Eagles. They like to talk about the Eagles.
Sure.
Something comforting. So it's been very helpful for us to have relationships with these providers and learn about their clients through these phone calls and establish the relationships to make sure that we can follow up and figure out, let them know what's going on with the client so that they can handle the next step and that we can collaborate in making sure that happens and putting a plan in place for, any future incidents.
Sure.
So once we go through and kind of troubleshoot the emails that we could just make phone calls on, then we look at the ones we need to go out and see the person. So we'll go out to the patrol follow-ups, talk to the person, see what's going on and what they're willing to do. Because a lot of times they might not be willing that day. We try to see why you're not willing to talk to anybody. Sometimes it's transportation, jobs, what works with their schedule, what works with their insurance. And coming into the mental health world and connecting people to care, learning about how the insurance world works has been eye-opening.
Certainly.
For sure.
So, I wouldn't, 12 years
That's a different Facebook Live, but
I would not ever say that I would know this much about insurance that I do now.
Right.
Having that conversation with people, how to use their insurance, how to use their care that is already set up. Sometimes it's just calming it down, waiting for the next day and seeing what they're willing to do. So it could be that day, or it could be, hey, I'll call this person on Thursday when I have more time because my kids are at school or this. So it's more on their schedule and what they feel safe doing. And then we're also available for any 911 in progress calls.
Okay.
So when the crisis is going on, if it's anyone that's suicidal, mental health, they will call our unit and ask us to respond. So we have the whole county. So adding that second team really helps split it up. So
I could guess so. Yeah.
Yeah.
So when does that second team start? Do you have a date yet or no?
we're still working on that.
Okay.
Hopefully, like midsummer,
Oh,
we
good.
would have 2 teams stood up and on the road, ready to go from the hiring and training and getting everybody spun up on how to respond to each.
Sure, sure. Well, that's great. That's great. So give me some idea of like the growth you've had. I guess in like this time last year, what did it look like, the calls and the numbers compared to now?
So with this time last year, we were around about 60 calls per service for our unit. For the
60
minute.
calls per what? Like month, per week, per
60
day?
calls in the month.
In the
So
month.
in a
Okay. Okay.
This time this year, we're at 162. So there's
Holy
been a significant increase in both mental health calls and suicide. So people really suffering from depression out there on their own,
Right.
not sure where to turn. And yes, COVID plays a huge part of this.
Mhm.
I also
Yeah.
think the stigma of asking for help has dropped. So people are more willing to ask. And we're seeing it from the
Okay.
very young to the very old calling for help.
Yeah. So you're saying that you think that the growth in calls is both due to COVID because of the circumstances people are in, but also could be due in part maybe to people more willing to ask for help. So like a combination. But I would suggest I would suppose that COVID is playing a huge part in that increase, right?
Yes, COVID is playing huge. The isolation, I think,
Mhm.
they're
Yeah.
already isolated a little bit to begin
Right.
with.
Right.
And now you're taking away the services, not taking away, it's changed. They're still
It's
doing
changing. Yeah.
counseling, but it's counseling over Zoom or it's
Right.
counseling.
Telehealth. Yeah.
Yeah, so that change
Sure.
affects her every day.
Yeah.
Are you seeing people? Yeah. I'm sorry. Go ahead. What?
That's okay. And the schedules, people's
Mhm.
schedules are totally, they're gone. The
Mhm.
routines are gone. And we know how much comfort routines bring everybody. I mean, myself, Officer Kearns, I'm sure you, Annie.
Yep. Mhm.
It's a very trying time, and people are asking for help. And, it's a good thing because we're at a point in our lives, everybody, where we're at a level where we've never been before. We're at a point where we're asking for help because we need to, because it's just unprecedented what's happening. And I think it's a great thing that people are asking for help, because there's a lot of help out there. And that's what, we're here for.
Absolutely. And we're so grateful that you're here. I mean, really, and that you're growing your team too, because clearly the need is there. So what do you want people to know? Like, you're on a platform now where people who might not know much about BHU can learn. Is there anything that we haven't covered yet that you want to make sure people know about what it is you do and maybe what you don't do?
Yeah, I mean, for our behavioral health unit, it is a great partnership from great leadership to realize that mental health is a concern out there and people need to be supported in the communities. So if you are experiencing crisis and you do have to call 911, it's not just going to be the police knocking in your doors. We're there to work with you, to work with your families, to work with the partners in the community to support you to live a good quality of life in Newcastle County.
Yeah.
So asking for help from the police could be very supportive and could connect you to care. And we like to thank our partners, NAMI, the Bridge, the state, Connections, ACT teams, that when we pick up the phone and say, hey, we have this situation here, can you help? Everybody has said, yes, this is what we can do. RI, Carlos at RI has been a huge help on some of our crisis scenes have been a little challenging. We don't know where to go. Having people out there to support us helps.
That's great.
I mean, I would like for people to know that this unit is here to, really support the community and law enforcement, the ties between the two. This unit exists and the police department exists to serve all community members and their needs. Just because somebody has, mental health illness, I mean, we're here to really try to help these people and put services in place for them, because we don't want to see, people getting sent to jail or people going to the ER and their mental health needs kind of getting put on the back burner and not getting addressed in a timely fashion.
Right.
And the mental health not being addressed and other issues, and it just goes around and around we go, and the suffering continues. So as a civilian and as a social worker in general, I really am in awe of this unit. And I remember reading about them in the newspaper a few years ago when I was a student, and I couldn't believe that they were doing this. I was like, this is amazing stuff right here, that they're going out and with the goal to just address the prevalence of people who have mental illness and they're going, and these guys are the first people who come in contact with people who are having the mental health crisis. I mean, that's not something that I think people think about every day.
Right.
They see it first. They're the first responders. So it's pivotal that they have the training, and it's pivotal to have the presence of this unit. And I feel very lucky to be a part of it. I really do.
We also have a veterans response team. So it's officers that completed the CIT program that NAMI helps put on for training. And then they're also veterans themselves. So police officers that are veterans completed the CIT program and then completed a veterans training program. So veterans that are out there suffering that need help can speak to another veteran. Yes, they're a Newcastle County police officer. They're also a veteran, so they have that connection. So NAMI has been a great partner with us on training our officers both in the CIT and the VRT programs. So we thank you for that.
Yes.
Absolutely. And we continue to be so grateful for all the work you're doing. And I know that we work together in a lot of ways. You mentioned CIT and VRT. Alex, our helpline staff, has reached out to you on various occasions, and you've reached out to us.
Yes.
And we definitely collaborate. Did I miss anything? Yeah. Is there anything else that we should be touching base on that? I think that's pretty much it, right?
Just that, no, you guys have been very supportive and phenomenal, and being able to refer families, friends to you guys for the programs and support groups, awareness events, outreach, having to do with their loved ones who are experiencing mental illness. The families always reach back out to me and they're like, thank you. And it's
and
really
we
big.
hear the same. Yeah, we hear the same about your team. We hear like when we connect family to you all, we hear the same gratitude. Just seeing a message now from Rand, still appreciative for NAMI Delaware assistance during his assignment. During his assignment to missing persons unit at Newcastle County Police. That's wonderful. Thank you. And hi, Lisa, and hi, Jackie. I'm just saying hi to some commenters here. Lisa May is saying hi, Officer Kearns.
She was the first social worker hired with us.
Wonderful. So this is Mental Health Awareness Month, and we're finishing it up with a theme this week called "You Are Not Alone." And you probably heard me say that at the top of this conversation. I wanted to make sure that those tuning in don't feel alone. Is there anything about that theme that you want to address or that you want to make sure is clear with regard to the work you're doing?
Sure. Not being alone is being okay to ask for help. And we here at Newcastle County Police Department, we want to be a part of that. We want you to be able to pick up the phone and call 911. If you are feeling depressed, suicidal, we are here to help, and we will connect you to the care that you need. And we do it by using our partners, social work on scene, Meadowood, huge partner in getting people into the right mental health. So we're trying to skip some steps. So you're not going to 1, 2, 3 hospitals. We'll call and try to get you right to the right mental health support. So you're not all over the place. We're going to keep advocating until you feel safe and you feel supported and you feel like you can live a healthy life in the community. And the same thing with Rockford. They're a huge partner with us with their outpatient and inpatient programs. And they're definitely people that we pick up the phone and talk to about cases. So we're not alone out here. We use our partners. And if you need help, you can call us and we will help connect you to care.
Great, great. And also for family members too. I know, Alex, you mentioned that earlier. You know that my personal story involves being a family member. And for so many family members that we work with, that I personally have worked with or that our team has worked with, we've heard that constant feeling of, I feel like I'm the only family going through this. And I'm the only one. And I don't want to tell anyone else this is happening in our house, because I don't want people to judge me or I don't want them to think bad about our family. But really, we want people to know that there's help out there and that it's not going to be looked at as a negative, right? Certainly in my own experience, I didn't call the police when I should have. Had I known you existed, I would have, because your team is amazing and the work that you're doing continues to be amazing. So for all those families out there who aren't sure whether they should call you next time that they need support, I hope that they'll reconsider and they will call you, because you've been nothing but supportive and helpful in this, and you continue to be. All right,
I hope that the caregivers take time for themselves, that they realize that they're part of this. You can't take care of somebody else if you're not taking care of yourself. So there are huge support groups out there and people that will help you along the way so that you can get a break, so that you can continue to be a caregiver.
Absolutely. Absolutely. And we need to remember that we can only be as good for our loved one as we can be when we're healthy. If we're not healthy, we can't be good for anybody. So we have to take the time that we need to take care of ourselves. And that might mean reaching out, going to a support group. And Alex, I would suspect that a lot of the conversations you're having on these calls or afterwards involve the family members too, right?
Yes, yep, they do. They're normally very upset and have been dealing with their loved one who has had mental illness for a long time. They're at the end of their rope, and a lot of the times you're just listening to them, and I'm making referrals for them, and you have to, I find a lot of the time I'm reminding them, well, what are you doing for yourself? Yeah. Okay, not to take away from what's going on with your loved one, but what's happening with you? What's happening with your other children in the home? What's going on with them? Because this affects the entire family.
Sure does.
This affects the entire family. So we have to make sure the whole family unit is doing well and is healthy. So yeah, it's very important that everybody is receiving some sort of service when there's somebody within the household who's struggling with serious
absolutely. It is a family illness. I mean, I think that's a way of looking at it. And it's great to know that you're embracing that kind of theory too, or that idea. Lisa just commented, she said, reach out, use hotline numbers if needed, and calling the police doesn't mean you will end up inpatient. I got to be honest, that was the reason I didn't call.
Yeah.
Because I was afraid of the response. I was afraid it was going to be worse. And that was my ignorance. And I'm speaking on behalf of other family members in other families who are probably in the same place. They just don't know. So that's why we work so hard at bringing that awareness about. It's not going to make it worse. They're here to help.
And I think a lot of people probably, like you just said, agree with that. And I have lived experience with this, and I'm sure a lot of us know people with lived experience. And our goal really is to keep people within the community. I mean, it really is. I don't know how else to say it, how to be more honest about it. The officers are trained for this to talk and de-escalate, and as am I. And it's really about just communicating with people and trying to keep them into the community and pulling their support networks out and trying to keep them healthy in the community. So if I could drive one thing home to anybody watching, is do not be afraid to call. Do not be afraid when you see a police car come up. I know it is intimidating. Give it a chance. Give it a chance.
Absolutely. That's a great closing thought, to be quite honest. We're finishing up now, and unless there are any questions from our comments, we're just seeing a lot of thank yous and agrees, and I appreciate all those. Is there anything else we need to cover or that we missed that you'd like to address, or just a reiteration of you're not alone, right?
Right, and thank you for having us, and good luck on the walk. I'll be walking this Saturday with you.
Oh, wonderful. Would love to know that you're going to be walking with us. Thank you so much. Thank you both, Alex and Officer Kearns, and have a wonderful week. Stay healthy, stay well.
You too.
Bye, everybody.
Bye.